Okay, this video is, do cataracts make you stupid? And of course the answer is yes. There used to be an old Dice Clay saying, he'd say two you know what and a heartbeat and a you know what, and I'm there. And I'm kind of joking, but when I look at head CTs, I almost always see this because I see tons, thousands and thousands of head CTs for memory loss, cognitive decline, dementia, so-called Alzheimer's, etc. Okay, and I also see tons of old guy fell, hit head, old guy fell, hit head, and I look back at their history. And I'll see the guy's had a bunch of head CTs in the last 2 years from falling and hitting his head. That's a sign that he's demented, okay? Because, the brain's more for motor than it is for thinking. All right, so what's the point? What does this have to do with cataract? Well, cognitive decline patients routinely have had cataract surgery on one side or another. Now, if you read the papers, like if you search this, you'll see cataract surgery lowers the risk of dementia as much as 30%, 29% lowered risk of dementia. But what I'm saying is, the fact that they have a cataract in the first place indicates they're high risk for dementia. Okay. The first thing that tends to happen is the guy becomes impotent. Okay, that happens early. The arteries to the Johnson, the pudendal arteries. Pudendal means shame. Arteries of shame to the Johnson in Latin. They're only about 1.5 millimeters in diameter. They close up pretty early. Okay, we talked about this before. 30% of guys in their 30s, 40% in their 40s, 50% in their 50s, whatever the decade, that percent approximately is impotent or more. Probably worse than that now. All right, and then the next thing that tends to manifest clinically is symptomatic CAD, coronary artery disease. Okay, then the next thing is they start losing some teeth, they're having all these dental problems, and then they're cognitively declined. The typical patient I see, by the time they're 60, they're fat, sick, and stupid. When I say stupid, I don't mean fully demented. I just mean they're mentally slow. And some of them are fully demented, but they're very routinely mentally slow. They start having falls or dizzy, memory loss. When I hear dizzy, usually the head CT is relatively normal, but dizzy to me means you better start thinking about, are they overtreating their hypertension? The most common cause of falls, dizzy, is that they're overtreating their hypertension, okay? They'll often have memory loss soon to follow. Okay, let's see what else I got here. Okay, then they're demented. Okay, then full-blown dementia. Then they're completely past the point of no return. Early on, there's a chance to help them if they go low-fat vegan, and almost none of them do they know what they're doing, or their doctor knows what they're doing, so they almost never do. Okay, what are the risk factors for forming a cataract? Aging, diabetes. That's a big one, diabetes. And I'm also getting, there's a joke in here. If you see the joke, you can let me know. Okay, so diabetes and hypertension, and dairy. And even though a person can have the enzyme to split lactose into glucose and galactose in the gut, that doesn't mean they can handle the galactose. Galactose is bad for little round things. It's bad for the eyeballs associated with cataract. It's bad for the ovaries, increased risk of ovarian cancer. Okay, another thing is a big old F- in your municipal tap water. That'll increase your risk of cataracts as well. Alcohol. Alcohol is like eating a high-fat diet. It gets converted in the liver to acyl-CoA and causes fatty liver. So diabetes is associated with high-fat diet. So high-fat diets increase your risk of cataracts, okay? Corticosteroid medications, they do something similar. They'll increase your blood lipids. They increase your stress response. I also saw some papers suggesting that excitotoxicity might increase the risk of cataracts. Does excessive psychological stress? I think it does in sleep deprivation. These mimic corticosteroids, but I don't have a paper with me. I did look up something saying excessive psychological stress was associated, though. High-fat diets. He talked about that. The same diet that's high in fat tends to be low in fruits and veggies, and thus low in vitamin C. Vitamin C is needed for making good, strong collagen. You're low in vitamin C, you might have a little bit more prone to having your teeth fall out. Many cataract patients are edentulous. That's the other thing I see. When I look at the CAT scan of a person's brain, if I see that they had unilateral or bilateral cataract surgery and they're missing a bunch of teeth, that patient's probably demented, okay? They sometimes have preservatives in some of these contact lenses that increase the risk of causing cataracts. Previous trauma to the eye can increase the risk of cataracts. Previous surgery to the eye can increase the risk of cataract. If the person's got excessive radiation at that level, like let's say they had head and neck cancer, squamous cell carcinoma or something, and their eyes were partially in the radiation field or close to it, they can get cataracts from that. If they had numerous repeat head CTs, let's say they had a ventriculoperitoneal shunt, a VPS, that can lead to cataract formation. Let's see here. Possibly standing near a microwave. Those give off a lot of energy. They used to say that based in some paper from Russia. So anyways, So here's the joke. I mean, the joke is that all of these risk factors for cataracts are the same risk factors for dementia practically. If you radiate the brain, you're going to worsen cognitive function. If you've had head trauma, you're going to worsen cognitive function. High-fat diets, they plug up your arteries and do other problems, increase your risk of cognitive function, usually associated with excitotoxicity. Excess stress, corticosteroids, sleep deprivation, they're all associated with excitotoxicity and increased risk of brain damage, okay? Smoking tobacco, you make your eyes ischemic, lack of oxygen and glucose delivery, not good, okay? They can't repair themselves. A lack of antioxidants because you're eating a high-fat diet instead of a plant-based, low-fat, plant-based diet. Alcohol is like a high-fat diet. That guy Lustig, kind of that pediatric endocrinologist, a bit of a paleo keto promoter, but he has a real clever line about alcohol and about high fructose corn syrup. He says high fructose corn syrup is alcohol without the buzz. They both cause fatty liver, okay, which means they both cause diabetes. Okay, and then we talked about F minus. So anyways, all of these things are risk factors for cognitive decline. So it's almost like whether or not the cataract itself is directly related to the dementia, because they have the same risk factors, the same patient has it, and cataracts tend to occur sooner. So they're super common. Cataracts are super common. I see tons of them every day, cataract surgeries. So anyways, it's pretty easy to avoid this. You can't help yourself aging. You can avoid the risk factors for diabetes. Eat a low-fat, low-sodium vegan diet. Dairy, just quit eating dairy. Filter your water. You know, you need distillation or reverse osmosis to get the F minus out of there. Don't drink alcohol at all. Don't smoke at all. If you have a reason for corticosteroid medications, maybe asthma or autoimmune disease, you might be able to reverse that with improved diet. So anyways, hope that was helpful.